And welcome back to The Factor Uncensored. We're facing two big problems in the world right now: COVID and monkeypox. Both issues are creating the perfect storm for health concerns. Are agencies ready to treat monkeypox while we also battle COVID? We put that question to our doctor tonight. And joining us on The Factor Uncensored tonight is Dr. Danish Ali from Arch Point Pain Institute. Dr. Ali, we have two big problems out there that we're dealing with in this country and around the world: monkeypox and also COVID-19. Is this the perfect storm? Are we ready for monkeypox on top of COVID-19 when it comes to getting the people the vaccines that they need?
Right, Isaiah. Yeah, so monkeypox has become a worldwide problem where the CDC has issued many statements across this past couple of weeks. We are seeing a rise in those numbers. We're seeing a rise of those cases in the emergency rooms and the hospitals as well. Currently, the recommendation is for folks who are at high risk to consider getting these vaccines. High risk means folks who are in the gay community having sex with other men, and those are folks that are potentially at higher risk to develop this. And so, yes, the recommendations out there right now. The problem is the county has been allotted a very small number of these vaccines, and therefore we're still awaiting more vaccinations in order to be able to provide and cover the wider frame of folks that need to be potentially vaccinated against this virus.
I think city leaders said that we initially had 5,000 doses, but that only went to 2,500 people because there are two doses, right?
That is correct, Isaiah. There's a two-part series to this, and yes, and you're right. It's about 2,500 folks that can make use of this, and so yes, the city officials have requested and are continuing to request more cases, more vaccines to be available to the folks here that may be potentially at higher risk.
And I think in New York, they've declared a public health emergency there, right? Because they've had quite a number of cases.
That's correct. We've also seen a rise in this number of cases in the homeless population, Isaiah, and so that's where that comes into place. Especially some of the hospitalizations that we're seeing are homeless folks that are potentially engaging in sexual activity with other men, and that puts them at a higher risk. And we're seeing folks coming in with those lesions, the fever, the general body fatigue, and the swollen lymph nodes that we see as well.
Is it possible to get COVID and monkeypox at the same time?
It is. Yes, there are different viruses and they affect differently. They're made of different genomes. And so, yes, you can get COVID and get also the monkeypox at the same time.
That would be a nightmare. Now, when it comes to COVID, dealing with that, we're seeing more people get sick, right? But not with serious symptoms that would land them in a hospital.
That's correct, Isaiah. Thankfully, these subvariants have not been as seriously causing illness as some of our initial variants in the initial virus that we got here in this country. And so we're fortunate in that. However, the numbers have skyrocketed, especially in Harris County. We're seeing a significant increase in cases. Some of those resulting in hospitalizations because of the concern factor that folks have, or they may not have been reboosted and now they're getting some symptoms. And so, yes, we're seeing those cases. Thankfully, they're not ending up in severe illnesses where they have to be intubated and put in the ICU for weeks. And generally speaking, they're able to get medications, antiviral treatments earlier in the course that helps to decrease the course and the viral load and also the symptoms as well.
What would you recommend to people who may have symptoms? They've been boosted already, they've been vaccinated. What should they do? Just treat the individual illnesses? How does that work?
Yeah, Isaiah, there are antiviral treatments now that have been released. And so that's why if you develop symptoms, get tested. And especially, take the at-home tests with a grain of salt, essentially, meaning that if you are having symptoms, you haven't been either vaccinated or boosted, and go get the actual PCR test. And then if you do test positive on that, Isaiah, talk to your medical professional. There are antiviral treatments out there that can be started that can help reduce the symptoms, the severity, and so that's very important to do that earlier in the course of this disease. Furthermore, it's important to maintain isolation and at least for 5 to 7 days, maintain that isolation where you're not transmitting this illness and virus to others.
All right, Dr. Donna Shaw-Lee, Archpoint Pain Institute. Thank you for your time on The Factor Uncensored, sir.
Thank you, Isaiah.